state your name and address, and then...
I'd just like to offer these packets, please.
Thank you, Mayor Lane, and all members of the Township Committee. Good evening. My name is Dan Hayes. I don't live in Neptune. I live in Monmouth Beach. But I am the president of HPAE Local 5058. That's the union that represents nearly 1,700 nurses at Jersey Shore Medical Center. I'm also a staff nurse there myself. And I'm here tonight to ask for your support in our fight for safe staffing in our union contract and in New Jersey law. Too often, nurses in New Jersey are working short-staffed, a problem that's existed for decades, but is now to the point where our entire healthcare system is in a state of crisis. In study after study, short-staffing has been shown to compromise patient care and safety, as well as nurse safety. Every healthcare worker and every patient is feeling the pain of short-staffing, while healthcare executives focus on profits. Our union is currently in bargaining for a new contract with Hackensack Meridian Health, the owner of Jersey Shore, and one of the largest healthcare corporations in New Jersey. In these negotiations, our top priority is to have guaranteed nurse-to-patient staffing ratios in our new contract, because our community deserves a level 1 trauma center where every patient is safe, a hospital where nurses aren't overwhelmed with more work than one person can possibly do, a hospital where nurses don't have to treat patients while hungry or desperate for a bathroom break because they don't have time to safely take a break, a hospital where experienced nurses don't constantly get burned out and quit. 3 years ago, our local publicly released a survey of our members showing that the majority of them would feel unsafe being treated in our own hospital. I'm sorry to say that in some ways, things have gotten worse. So many of our experienced nurses are gone. After decades of offering incentives to nurses picking up extra shifts, the hospital is now refusing to offer any shift incentives at all, despite our contract saying they should. It seems like more corners are being cut all the time in the name of productivity. Our union, HPAE, has settled 9 contracts with safe staffing across the state. Patients in Bergen, Hudson, Essex, Middlesex, Camden, Gloucester, Cumberland, Salem, and Ocean counties all have hospitals with safe staffing ratios. Now it's time Monmouth County has the same here in Neptune. Decades of studies researching California's mandated staffing ratios have shown California patients are more than twice as likely to report higher satisfaction with their care, and nurses reported significantly lower burnout. One such study showed that an increase from 4 patients per nurse to 8 patients per nurse escalates the risk of death by 31%. The risk is not hypothetical. Ask our nurses. Some of them will tell you that there are days where they've had to take 9 or 10 patients. That's not a risk that anyone should have to take. Nurses are held to the highest standards of care, but our executives are not being held to the same high standards. They should be held to a standard that allows us to do our job safely and effectively. At a time of shortened hospital stays, increased acuity levels, and more complex medical technology, our patients need more nursing care, not less. Dozens of other municipalities in New Jersey have passed resolutions supporting union nurses who are advocating for safe staffing in union contracts and state law. On behalf of 1,700 nurses, I'm asking the Neptune Township Committee to do the same. Please pass resolutions supporting our fight for safe staffing in our next contract and supporting a bill for safe hospital staffing at the state level. That's a bill called the Patient Protection and Safe Staffing Act. That's A3683 and S2700. Thank you, Mayor Lane, and to the rest of the committee for your time and consideration, and I also thank you for those supportive comments earlier. Thank you.
Thank you.